I get patients asking me, Doctor, what is hair transplant? Is it safe? Am I the right candidate for this? How much time does this procedure take? So these are some of the most commonly asked questions we get from our patients, and today I'll be answering each of these in this video. Hello all, myself Dr. Rahul Jagiasi, hair restoration consultant and hair transplant surgeon at VISAGE Aesthetic Clinic, Kharghar Navi Mumbai India. A warm welcome to all my viewers to my YouTube channel. So let's get started. Hair transplant is a surgical procedure which involves removing hair which are permanent and resistant to balding from the back and sides of your head and transplanting them to areas that have lost hair due to balding, scarring, or to many other reasons. So medicines and topical solutions can only help grow those hair follicles which are present but are sleeping or dormant. But in areas where there are no follicles present, like in case of baldness, where you can literally feel smooth skin of your scalp when you move your hand around, hair transplantation is the only solution, as we implant new hair follicles there and later help them grow with these medicines and topical solutions. Oh yes, the transplanted hair is not rejected and it is not a foreign tissue at all. It is your own native hair. It maintains its own characteristics like color, texture, growth rate and curl after transplantation and regrowth. Also, its vitality is maintained by a very rich blood supply of your scalp. The procedure is relatively simple and safe, and it is performed as a day care procedure under constant monitoring. Patients go home the very same day. Any candidate about 25 to 30 years of age, where their hair loss has been relatively stabilized and have healthy hair in their donor area to be used as grafts, are right candidates for hair transplant. Younger patients below this age group, where hair loss is progressive and ongoing and where their hair loss pattern is not yet established, should be managed conservatively with medicines and topical solutions first. Also, individuals with hair loss from scarring, scalp injuries can also benefit from this procedure. Like with many other cosmetic procedures, a hair transplant does not hurt at all. In the FUE method which we practice, there is absolutely no pain. In the entire procedure, the clients are awake as the scalp is injected with local anesthesia and the client is not likely to feel any pain. The only minimal discomfort during the procedure which may occur is when local anesthesia is being injected. So for that too, we use cryotherapy and vibratory anesthesia. Also, post-procedure there is bare minimum discomfort which is taken care of by the medicines which we prescribe. A typical session of between 1500 to 3000 grafts normally involves 6 to 8 hours of surgery on an outpatient basis. Most patients arrive in the morning and will have their procedure done by afternoon. In the FUE method which we practice, we advise a day or two of rest and ask our clients to avoid any vigorous or strenuous activity for a week. Clients can resume work the very next day if that involves test of work and anything which doesn't involve much of an activity. Work which involves a lot of traveling has to be avoided at least 3 to 4 days post surgery. Usually within the first 4 months, you can expect to see new hair growing. Between 6 months to an year, you will see significant changes from before, like your hair will be longer, thicker and denser in volume than before. While it may take a while for your new hair to grow completely, the hair that is growing is permanent and will continue growing for your lifetime. Since the hair follicles that are transplanted to the balding areas are taken from the permanent and genetically resistant areas from your scalp, they will grow for your lifetime. So these were some of the most commonly asked questions related to hair transplant procedure, and I have tried to answer most of them. If you have any further questions related to this procedure or hair loss or anything related to hair in general, I'll be more than happy to answer. You can type your questions in the comment box below. This is Dr. Rahul Jagiasi signing off. Bye bye.